Hi, good evening. My name is Isabel, and this is my presentation on HIV or human immunodeficiency virus. A short introduction. Immunodeficiency virus is an infection that attacks the body's immune system. It is important to note that it has been difficult to find a vaccine that can cure this disease as it is a retrovirus. Retroviruses are a type of RNA virus that's defined by its mechanism of replication via reverse transcription to produce DNA copies that integrate into the host's cell genome. I'm going to explain a little bit more about the disease so it's clear. I think those genetic things sometimes can be a bit hard to understand. So just a little bit of history. HIV originated in Central Africa in the first half of the 20th century, when a closely related chimpanzee virus first infected humans. An epidemic global spread began in the late 1970s, and AIDS was recognized in 1981. Back then, in those decades before there was a lot of investigation and more medicines coming out to fight against the disease, it caused a lot of deaths. So that's why it's so important that we're still talking about it now and recognizing the history of this disease. A little bit more about this disease. HIV targets the body's white blood cells. They are the defense, let's say, of our body. So that means that it weakens our immune system. This makes it easier to get sick with diseases like tuberculosis, infections, and some cancers because if we have no defense system, then how we're going to fight against other diseases. HIV is only spread by body fluids. This includes blood, breast milk, semen, and vaginal fluids. It is not spread by kisses, hugs, or sharing food. That can be a common misconception. It can also be spread from a mother to her baby. HIV can be treated and prevented with antiretroviral therapy, or ART for short. Untreated HIV can progress to AIDS, often after many years. This is a simplified pathology of HIV, like how it occurs in the cells and why it propagates as a virus. So phase 1 means that HIV attaches to and penetrates host T cells, and then they release the HIV RNA enzymes into the host cell. HIV reverse transcriptase copies viral RNA as proviral DNA. So let's say, the HIV attaches to our T cells, which are the ones that kind of tell the body when something is good for us or something is bad for us in a simple way. So then once it attaches and it starts doing these copies of viral RNA as proviral DNA, our cells recognize the HIV RNA in our DNA as something that is not harmful. So they usually do not attack the HIV DNA that is now starting to propagate into our own DNA or into our own cells. So proviral DNA enters the host cell's nucleus, and HIV integrase facilitates the proviral DNA's integration into the host DNA. So that means that, yes, HIV is like a very insidious illness that makes our own cells or tricks our own cells into believing that it must not be attacked. Phase 3, the host cell then produces HIV RNA and HIV proteins. HIV proteins are assembled into HIV virins and budded from the cell surface. So the cycle repeats. It makes more of these HIV virins, like these little viruses, that go into more other cells and do the same process. So the HIV protease cleaves viral proteins, converting the immature virin to a mature infectious virus. So there you have it. It's a cycle. These virins convert into mature viruses, and they, as you can see here in this drawing, um, they they attack other cells, or not attack, but let's say like go inside other cells and start doing this replication of their DNA into our own. And this is how viruses usually survive in our body. But the retrovirus, because of its way of doing the reverse transcription, it makes it way harder to fight off because it actually tricks our body into believing it's good for us or it's not something harmful. So, symptoms and signs of HIV. In the initial HIV infection is when we may be asymptomatic or there's non-specific symptoms. This is usually recognized as acute retroviral syndrome, which usually begins within 4 weeks of infection and usually lasts to 3 to 14 days. Symptoms and signs are often mistaken for infectious mononucleosis or benign nonspecific viral syndromes that may include fever, malaise, fatigue, several types of dermatitis, sore throat, arthralgias, generalized lymphadenopathy, and septic meningitis. So sometimes it's very hard to detect HIV on your own without testing because it has a lot of symptoms that are non-specific, which means that, yeah, you might get a fever, but it might not be of HIV. There's a lot of illnesses that come with fever. There's a lot of illnesses that come with sore throat. There's a lot of reasons why our lymph nodes might be swollen. So these are not very specific, and that's why it's important to have HIV testing available. Then comes the latent period. After the first symptoms disappear, most patients, even without treatment, have no symptoms or a few mild intermittent, non-specific symptoms for a highly variable period, like for 2 to 15 years. Imagine, like there's no symptoms at all for 2 to 15 years until, well, we'll see a little bit more about what happens when HIV is not treated for so long. So we're continuing with the latency period. Symptoms during this relatively asymptomatic period may result from HIV directly or from opportunistic infections. The following are the most common. So let's say that there's no specific symptoms to HIV, but since our immune system is weakened, there's a lot of infections that may occur during this period. So most common are lymphadenopathies, which I was mentioning, the lymph nodes that swell certain parts of our body, like where our lymph nodes are. As you can see in the picture here, the girl here has a swollen lymph node. White plaques due to oral candidiasis, which is like a very common fungus um, that infects our body. Herpes zoster. Um, this is also known as shingles, which is something that is very common in people that get chicken pox from a very young age. When there's a weakened immune system, this triggers this herpes type of herpes. So since HIV weakens our immune system, this may trigger these types of diseases. So this is why it's so hard to actually put symptoms that are specific to HIV because they're never specific to HIV. It's just because we have a weakened immune system. Diarrhea, fatigue, and fever with intermittent sweats. Sorry. So also mild to moderate cytopenias are also common. Cytopenias are, for example, anemia. Some patients experience progressive wasting, which may be related to anorexia, and increased catabolism due to infections. Because when someone's sick, usually they don't want to eat. So anorexia can be a very significant symptom in this disease. Let's continue. So, what happens when we're in this latent period that I mentioned that it was from 2 to 15 years or 14 years? It's a long time for one to not notice a disease. And it's different for everybody. It depends on the immune system defenses that the person has. But, well, in in short, the two main consequences of HIV infections are damage to the immune system, specifically depletion of CD4 lymphocytes, and immune activation. So, infected CD4 lymphocytes have a half-life of about 2 days, which is much shorter than that of uninfected CD4 cells. Rates of CD4 lymphocyte destruction correlate with plasma HIV level. So when the CD4 counts drop to 200, nonspecific symptoms may worsen and a succession of AIDS-defining illnesses develop. So this is why it's very important to have screenings for HIV, because once it surpasses this count drop, it can lead to way worse, not even symptoms, illnesses. You talking about heart failure, sores, um, cancer, so many diseases that when our body can't defend ourselves against it, it makes it way worse. So this is why um, you may be a long period of time without noticing the symptoms of HIV, but once you get a disease like tuberculosis, for example, it is very hard to treat the person once it had developing HIV that it was never treated. So now we're going to talk a little about the epidemiology of this disease, since our main focus here is why is it important um, to talk about this disease in our community. Why is it important to prevent it? Why is it important to cure, or not cure, but uh, help people that have this disease get better? So if we look at data from 2021 from the World Health Organization, 3.8 million people worldwide, including 1.7 million children, were living with HIV. 54% were women and girls. Common misconception in most people is that they're gay men, but it's it's not like that. Like HIV can happen to anyone. In 2022, also the World Health Organization estimated 39 million people living with HIV at the end of 2022. So in 1 year, another million people were infected with HIV. Two-thirds of whom, 25.6 million, are in Africa. And in 2022, it was also estimated that 630,000 people died from HIV-related causes and 1.3 million people acquired HIV. So, in our community, Quintana Roo, why is it so important? Well, as you can see here, this is very impactful. In Quintana Roo, 10.4 of every 100,000 inhabitants have been infected with HIV. So we're the number one state in Mexico with uh, the the most prevalence of this disease. As you can see here in the little uh, I forgot the name. This picture I have below, Quintana Roo is 10.4 people out of 100,000 inhabitants, while the other states below are way lower. Well, in comparison to Quintana Roo, are way lower, like from 10 to 7. I think it's a lot. Yucatan even. Tabasco is not even that big of a state, and it's still way less than Quintana Roo. So we really have to take this important statement into consideration. Now we're going to talk a little bit about the transmission of HIV. There is four very typical ways. The first one is sexual. direct transmission through sexual intercourse. I'm going to talk more in depth about each one and how risky they can be and why or how. So I'll continue. Needle or instrument related, sharing of blood contaminated needles or exposure to contaminated instruments. Transfusion or transplant related, and vertical. This means that it's a transmission from an infected mother to child during pregnancy, childbirth, or through breast milk. What are the risk factors? It is very important to know that the most important risk factors of this disease are poverty and sexual violence, lack of education, sexual education most importantly, healthcare systems that do not provide access to HIV testing and antiretroviral drugs, stigmatization, criminalization, and discrimination against people with HIV. We have to stop having this stigma uh, with this disease because the less we talk about it, the more people are at risk of contracting it. Transfusion, now I'm going to go into depth of each way we can get this disease transmitted. So first is transfusion and transplant related transmission. You might think that it's not very common because of course in my private hospital they probably screen for these for the blood I donate or the organs. Obviously they should know that it's not contaminated with the virus. Well, yes, it is not very common. Uh, Obviously, it's very common to screen the blood and organs. However, in many high HIV burden countries, like Africa, where blood and blood products are not screened for HIV, the risk of transfusion-transmitted HIV infection remains high. Because yes, for example, in the United States, the risk is 1 in 2 million. So not very common, but of course in places that don't have the infrastructure, don't have the economic means to run these tests are more at risk. Here I put a very good table that has to do with the risk of sexual activities and how high or low is the risk depending on the sexual activity, if there's none. And well, I don't want to go through each one because then it'll be too long. But let's say that the highest form of risk through sexual means is vaginal or anal intercourse with or without ejaculation if a condom is not used or is not used correctly. We always must remember, without a condom, a lot of high transmission risk. Now, needle and instrument related transmission. The risk appears to be higher if the wound is deep or if blood is inoculated. Risk is also increased with a hollow bore needle and with punctures of arteries or veins, compared with solid needles or other penetrating objects coated with blood because larger volumes of blood may be transferred. Thus, sharing needles that have entered the veins of other people, like people that inject drugs into themselves, it's a very high risk activity. So it's also important to make people that make the use of these drugs in which they have to use needles to inject them, give them well, let them have this information that sharing needles is a very high risk factor for transmitting HIV. And then last, the vertical or maternal child transmission can happen during pregnancy, during childbirth, and via breast milk. A lot of people have this misconception that if the mother has HIV, surely the baby will, and that the baby cannot have the breast milk of an HIV infected woman, but it is not true. The overall cumulative risk of vertical transmission without antiretroviral medication is 35 to 45%. Transmission rates can be reduced significantly by treating mothers with HIV infection with antiretroviral drugs while they are pregnant, in labor, and breastfeeding. So, if the person is in treatment and their CD4 levels are fine, the baby will probably also be fine, and we would never it would be the last option to not recommend breastfeeding for a baby, since it's the most important uh, part of their growth and development, the breast milk. Cesarean delivery and treatment of the infant for several weeks after birth will also reduce the risk. HIV is excreted in breast milk. The overall risk of transmission through breastfeeding is approximately 14%, and this is without medication, reflecting varying durations of breastfeed and plasma viral RNA concentrations. So the risk is high in women who became infected during pregnancy or during the period of breastfeeding, because if they were infected and they still hadn't had the treatment, it's very hard to get those levels to a normal one where the baby won't be at risk. Now, the diagnosis. There's two types of tests: HIV antibody testing with or without HIV P24 antigen tests, and nucleic acid amplification assays to determine HIV RNA level, or the viral load of HIV. So the HIV P24 antigen is used when the detection of antibodies to HIV is sensitive and specific, except during the first weeks after the infection. However, the HIV P24 antigen is already present in the blood during most of this time and can be detected. So it's like a quick way to determine that someone has HIV. Now, the HIV RNA level is usually used when the HIV P24 antigen test is positive, and an assay to differentiate between HIV type 1 and HIV 2, and an HIV RNA assay is done. Stages. HIV infection can be staged based on the CD4 count. So it kind of, the stage is how acute is the infection. So stage 1 is when the patient has more than 500 CD4 cells in their blood. Stage 2 is 200 to 499 cells. And stage 3 is when there's less than 200. Like we had mentioned before, when there's less than 200, people that are infected with HIV are more prone to developing AIDS and its subsequent problems that come with it. Recovery. The CD4 count after 1 to 2 years of treatment provides an indication of ultimate immune recovery. CD4 counts may not return to the normal range despite prolonged suppression of HIV, but it is possible to get to a level where it's normal and the person lives their fullest life. Screening. Screening antibody tests or newer combination antigen antibody tests should be offered routinely to adults and adolescents, particularly pregnant women, regardless of their perceived risk. So it's very important that we have free and private HIV tests in various healthcare centers. Now, treatment. This is a very simplified way of talking about the treatment. It's a very complex subject, but I'm gonna describe a little bit about the two most common treatments for HIV. So combinations of antiretroviral drugs, or ART, called for short, sometimes called highly active ART or combined ART, are recommended. It's recommended for all patients. These are the meds, the drugs. A lot of people think that it maybe it's not good to take them because they have a lot of side effects. And yes, it can cause a few side effects, but it has been studied, and it's better to have these side effects than suffering the complications that come with a low CD4 cell count. You have less risk of dying, and you can live a normal life. because there's been a lot of investigation and scientists still conclude to this day that these drugs are the best option for people that have infection of HIV. So in case these art drugs are not working, this therapy of drugs is not working, um, a second option is called chemoprophylaxis. So this is for patients that are at a high risk of contracting a very serious infection like tuberculosis, or they have a concurring infection that they can't get rid of. They can't get rid of even though they're taking the antiretroviral and it's putting them at risk. Um, so it can be, for example, for Candida, Cryptococcus, P. gyrobechi, and MAC, Mycobacterium avium complex, that are dangerous for people that have HIV because they can die from it. They're high risk of dying when they contract these diseases. And if the therapy restores the CD4 counts to above the threshold values for more than 3 months, the chemoprophylaxis can be stopped, because obviously it's the same as chemotherapy. It has a lot more side effects than the art therapy. So now, what recommendations can we have for our public health system in relation to HIV infections? So we need public education. This means sexual education. Children need to know why it's important to have safer sex practices, which is the second, but without the without going to the stem of the problem, the root of the problem, which is education of the population. There's no way they will know about these safer sex practices. So this can start from just explaining to kids that they need to use a condom to have less risk of contracting this infection. Safer sex practices, counseling for people who use parental drugs. This comes to this part that I was explaining, that the needles, when people use drugs and share needles, they're at a high risk of contracting HIV. So we also have to make campaigns in order for people to not reuse needles, offer new needles. There's a lot of countries that actually do that. They offer free needles for drug users, because it's very hard to just make the problem go away, make people that use drugs just don't use drugs. So we can start from there. Confidential testing for HIV infection, free testing. It needs to be publicized. It needs to be something that is very common, and this comes from education. Counseling for pregnant women, appropriate screening of blood and organs, pre-exposure prophylaxis with antiretroviral. This is called PrEP, this system. This is for people that live, or not live, more like they have um, a sexual relationship with someone with HIV, sometimes to prevent for this person to also get the HIV transmitted, which is not, it doesn't happen if the other person that does have HIV is controlled, but it's also a good way to prevent this infection, as when someone that takes the retroviral therapy um, has a lower risk of contracting HIV. Also, universal precautions. This means that healthcare workers need to know never to use a used needle, change their gloves after touching bodily fluids, not touching open sores, and then touching someone else after, those types of things. And treatment of HIV infection, which maybe it's obvious, but a lot of countries do not have the accessibility to the treatments that I had been talking about. So, as a conclusion, although not as deadly as it was back in the 90s, thanks to medical advances, it is still very important that healthcare workers and people in general have a conscientious outlook on the infection and its prevention, sexual education in schools, free and safe testing, reversing the stigma around HIV, access to retroviral drugs, and more are all very important to stop the spread of the disease that has been prevalent in our community. Thank you for your attention. These are my references. See you next time.